Hi Sham, how are you?
I'm fine. How are you?
Good, 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 good.
Yeah, I have a question.
Hmm.
Recently, during the winters, I had a little bit of blocked nose.
Hmm.
Now, one can put a medicine, one can apply Vicks, but I wanted to know any breathing technique with which the blockages of the nose, the nasal passage, can be changed or can be cleaned. So tell
Yeah,
me about.
very good question. Actually, people use drops, nasal drops, and epinephrine and antihistaminic medications and things like that. Now, our body can generate our own medicine. That's the interesting part about this. And some breathing techniques are such that you can really, really get the benefit of this particular understanding. Okay. So all I'm going to do is demonstrate to you how we're going to do this. Say your nose is blocked, but you can breathe a little bit. Now, if your nose is completely blocked, you can breathe a little bit through the mouth, for example. I have my nose is blocked, and my voice will be also changing a little bit, because the nose is the blocked nose. But what I'm going to do is I'm going to take a little bit breath even through the mouth, and then I'm going to pinch my nose
Yeah.
and breathe out. Close the mouth and try to breathe out. Now, the way I will do it is I'll show it to you. Inhale first, exhale first. Inhale and exhale. If you have to do it through the mouth, that's okay. Then after exhalation, pinch the nose and then bend your neck and try to exhale. Push the belly back like you're forcing air outside the nose, but the air is not going out. Now, when you do this a belly, there's a pressure that builds up in the back here. Okay,
Yeah.
and what it does, I'll explain to you afterwards. Okay, so let's do this. Let's practice this.
Yeah.
So imagine your nose is blocked. So breathe through the mouth a little bit. Inhale, exhale, and inhale a little bit, and exhale. Pinch your nose, bend your head, sit straight, and try to blow your nose. Exhale, tighten your belly, and then let go and inhale. How do you feel the difference in the nose air entry, air?
Yeah. What happens is like, for example, when I was young, I had an ear infection.
Uh-huh.
So very similar exercise a doctor had showed me to clear out the blockages of the ears. With your
Mm.
exercise, the same thing happens.
So you were able to, what was the drainage like? Drainage was the ear
It,
drainage?
it goes through the air, whatever left, because once we exhale from the mouth,
Right,
we have very little left in the nasal cavity, the
right.
air to breathe out. But whatever little is left, first of all, it puts a good relaxation on the belly because we have to push through the belly and it comes out of the ears. I felt something in the ears.
Yeah, popping of the ear. This is because there is a tube that connects the pharynx, the area, the mouth here, and the ear. It's called
Yeah.
eustachian tube. These tubes are connecting. So many times that happens, but what we are doing here is we are basically not going in the ear, breathing into the nose. When you breathe
Yeah.
into the nose like this, exhale, it goes into the sinuses here. So let's do one more time. Inhale, exhale, inhale, exhale. Pinch your nose and push it to the sinus, not the ear, like you're blowing through the nose. It increases the pressure and then relax. It increases the pressure in this area, the face. Focus on this, okay? Did that work out?
Yeah, because it goes through the nose to the ear. So obviously the nose will get relaxed. The
So what
blockages will
what happened
release.
this time for you? Yeah, what happened this time for you?
The nose, it felt a little lighter comparatively. And
Okay.
obviously, because from the nose only it goes to the ears. So the nose gets a little bit relaxed. We won't know it because right now my nose is on. It is not blocked right now.
Right. But did it go to
But
the ear just now?
if I would have known about this exercise, then I could have done it.
Did it go to the ear this time?
Yes.
It
It
did.
started with the nose. It started with the nose. This cavity got filled up a little bit because the air goes through that cavity.
Okay. So what happens is basically it is the sinuses that get the extra carbon dioxide builds up when you're exhaling. After the exhalation, you are pitching the nose. So carbon dioxide builds up and the nitric oxide gets generated in this. And these all open up the airways.
Okay.
Airway opening occurs very good because of these two gases. Now, the other thing that I'm going to show it to you, we're going to stand up and we'll go
Okay.
walk a little bit. So inhale, exhale, and then after exhalation, we'll pinch the nose. And then after pinching the nose, walk a few steps as much
Okay.
as you can till you get mild air hunger. Okay, mild air hunger. So let's do
Okay.
that.
Yeah.
Stand up and we'll just basically inhale, exhale, pinch your nose, and walk. And as you develop the air hunger,
Yeah.
your amount of air that's coming out through the inhalation, the nose opens up. So unblocking of the nose is excellent technique to use this by blocking the nose first, exhaling against the resistance a little bit, and then walk around. When you walk around, the carbon dioxide is also more. You also have a little bit extra nitric oxide that is produced. It opens up the airways. Okay. So
Okay.
instead of using the medications, this is a technique that you can use. Okay.
Yeah, that's the reason I asked the question because it is no point putting medications in your body when it can naturally heal with a breath practice.
Right. Try that out. And many people have allergies and things like that, and they start using, drops. Nose drops can develop habit, and also can, in fact, it is known as a rhinitis medicamentosa. It's a big name. From medications, the rhinitis and the inflammation of the lining occurs. So you can avoid this by using this breath technique. Okay.
Yeah, yeah. Yeah, it was really great. Really enjoyed and